from an organic way. I'm doing it from the perspective of you taking your exam and helping you to process how you should be answering the questions. This is what you have to do. All right. You all did an amazing job. And if you learned something, that is priceless. Okay. Question 4. How would you code this encounter? The patient is seen. Oh, let me just go ahead and say the answers. A, H40.10x2, B, H40.1111, C, H40.9, and D, H40.1112. The patient is seen in his ophthalmologist's office and treated for bilateral open angle glaucoma, moderate staged. How would this encounter be coded? Okay, you have a minute and a half. Your time begins now. Okay, coders, here we go. First things first, let's go ahead and inventory. We have bilateral, open angle glaucoma, moderate stage. That's it. Okay, so the key word here is bilateral. We're going to have to code for both eyes. Both eyes have open angle glaucoma, moderate stage. So if we look at this, the answer's up at the top, and I'm going to go ahead and apply my forensic reading. If you look at H40.111, this is primary open angle right eye mild stage glaucoma. Okay, coders, there is no mention of primary open angle glaucoma. There's no mention of primary. We just have bilateral open angle. That is a very specific type of glaucoma. There's no mention. So if there's no primary, then anyone that's coding, any answer that's coding for H40.111, that's incorrect. Also, H40.112, that's primary open angle glaucoma, right eye, moderate stage. And if you look at these answers, who's coding for the left eye? This is bilateral. All right, so H40.112 got to go as well. We're getting rid of D. That leaves us with A and C. Now let's look at H40.9. This is unspecified glaucoma. Well, we know it's open angle glaucoma, so it's not unspecified. The doctor just didn't say glaucoma. And so we are going to eliminate C. And A is the best answer of the 4. Unspecified open angle glaucoma, moderate stage times 2. That X2, that's 2 eyes. Okay. So A is our answer. Well, yeah, it's times 2 in this case. All right. How are you doing? I see people self-correcting. Outstanding, outstanding. Great job. And if you have comments, go ahead and put them in the chat. But we have another scenario. What codes would be reported for this encounter? A, D53.9, K29.70, B, D53.9, K29.70, and R00.2. C, D53.9, K29.70, R10.9, and D, D53.9, K29.70, R00.2, R10.9. Inpatient admission. The patient is a 78-year-old female with heart palpitations and abdominal pain who was brought to the ED by her grandson. The physician ordered an EKG, a complete blood count, and upper GI series. The GI revealed significant gastritis. The EKG was not significantly abnormal. The CBC revealed the following: HCT 23%, HGB 6.5%, and WBC 6,000. The cardiologist who admitted the patient into the hospital indicated he felt the palpitations were a symptom of the patient's significant anemia. Social services were notified because the physician felt that the patient was not receiving the proper nutritional support, causing the hemoglobin deficiency. The patient received 2 units of packed cells and was discharged the following day. The discharge diagnoses included nutritional anemia and gastritis. All right, you have a minute and a half, coders. Your time begins now. Okay, I see. Wow, you all did pretty good. All right. Oh, I don't think my timer came on. I'm going to give you a little more time, okay? Just a few more, but I think most people answered. Okay, I'm back. All right, so first things first, I'm going to highlight my key terms. And I have heart palpitations, abdominal pain. Patient had EKG, CBC, and upper GI. Gastritis, admitted by the cardiologist, anemia, improper nutritional support, and blood transfusion. Mrs. J, why are you writing all this down? Because I'm extra. All you need to write are the diagnoses, signs, and symptoms, and that's pretty much it. But sometimes I write some additional things, right? Let's go back. What's going on here? How am I? Okay, here we go. I don't know how that happened. Okay. All right, so knowing categories on site is helpful. It really is because um I'll tell you in a moment. But this is coming up. It's saying palpitations were a symptom of the patient's significant anemia. All right, so that is significant. But what I want to do is eliminate the items off of this inventory list so I can really focus on what needs to be coded. All right, so again, we do not code signs and symptoms that are related to a diagnosis on this list. And so let's go ahead and identify the diagnoses. If you look, gastritis is a diagnosis, and so too is anemia. So the reason I highlighted this palpitations were a symptom of anemia because we could have very easily have coded for these palpitations if they weren't related to anything on this list. And typically, we would say that palpitations is not related to gastritis or anemia. Typically, right? Are you all with me? But the doctor links it. So it's related. So we're going to get rid of the palpitations. We're going to get rid of the abdominal pain. Of course, get rid of that ECG and CBC. We're going to get rid of admitted by cardiologists, improper nutritional support, and blood transfusion. And the reason I got rid of improper nutritional support, in the real world, we would code it. But if you look at our answers, there are no encounter codes or Z codes there. So they're not coding for it. So all I need to code for is gastritis and anemia. Now, if we know our categories on site, D is the category for drawing blood, or Dracula draws blood, right? D, we know this is a blood code. And K is a kick in the gut. And we know that is a gastroenterology, from the gastroenterology category. And these R's are signs and symptoms. We've eliminated all of the signs and symptoms, so we're not coding for them, right? And A is our answer. D, 53.9 is the code for gastritis, and K29.70 is the code for anemia. And if you said A, outstanding. But if you learned something, priceless. Somebody in the chat said they don't have their book and they're going off memory. Outstanding. I love it. I love it. Okay, coders, are you with me? Let me know. Just if we're way off. But remember, this is Mrs. J taking the test. So this is all we have, right? By the way, we're not really looking up a lot of answers. We're not looking in our book too much, right? That's right. Somebody said, let's go. And you know what? I see you in here. You are rocking it too. I see you. And I know you. You don't know me, but I am your instructor. So I know you. You are an excellent student. Okay. Here's the question. We don't really have a What codes are reported for this condition? A, E11.9, J84.9, R09.02, K92.1, M06.9, N18.9, T38.0X5A, and Z79.4B. E09.9, J84.9, R09.02, K92.1, M06.9, N18.9, T38.0X5A, C, E09.9, J84.9, K92.1, M06.9, N18.6, T38.0X5A, and D, E09.9, J84.9, K92.1, M06.9, N18.9, and T38.0X5A. A 77-year-old white female is seen with interstitial pneumonitis. Hospital course here has been complicated by hypoxemia, renal insufficiency, and steroid-induced diabetes mellitus. The patient has been taking steroids as prescribed for quite some time for her rheumatoid arthritis. The patient reports having episodes of small volume painless hematochezia at home secondary to hemorrhoids. Last evening and this morning, the patient experienced larger volume bright red blood per rectum. The patient reports having a colonoscopy about 3 years ago, performed elsewhere, revealing diverticulosis and hemorrhoids. She states she had sequential colonoscopies performed in the past. However, she's unclear on the findings. Okay, coders. I tried to, go a little slower, but now it's your turn. Your time begins now. Okay, coders. All right, let's do this. First things first, you know what I'm going to do? I want to tell you something. Whenever you are coding from documentation, the final diagnostic statement or the discharge summary is golden. You pretty much code everything on that final diagnostic statement. So when you see something that says final diagnoses upon discharge, all of these are codable without a doubt. You code them all. And then you go up in the documentation and see if you can find anything else. And that's what I did. I started with interstitial pneumonitis, that's in the documentation, as well as the final diagnostic statement. Hypoxemia is in the documentation and the final diagnostic statement. Renal insufficiency is as well. and steroid-induced diabetes mellitus. And I put in parentheses that it's secondary diabetes, right? Anytime something other than your system caused the diabetes mellitus, then it's secondary. Well, typically, we don't say anytime. You're not always, but typically, if it's not systemic and it's caused by something else, it's secondary. All right. Also, rheumatoid arthritis was documented in the documentation, but it wasn't in the final diagnostic statement, but it's still codable, right? Because the steroids for her rheumatoid arthritis actually caused the diabetes mellitus. Hematochezia is documented in the documentation and the final diagnostic statement. And also hemorrhoids and diverticulosis are documented as well. All right, so we're going to go ahead and we're going to solve this scenario. So it's really important that you remember, here's a tip, know your categories by site. And you must code everything on the discharge summary. Make sure that you do that. And I don't see anything that we can eliminate from this inventory list, but I do see something I can eliminate from the answers. Anybody know? Yeah, somebody said they like that process of elimination. What's the first thing that we can see on site that we can eliminate? Anybody know? Well, I'm talking about from the answers. That's right. Somebody said they can eliminate E11.9 because this is diabetes type 2. This is not secondary diabetes. We are not coding for type 2. We're coding for secondary. So we can eliminate A. It's got to go. That's wrong. And so too is insulin. There's no mention that this patient's taking insulin, right? A got to go. How do you know that's insulin, Mrs. J? That's on the list of items to know on site. Z79.4. All right, coders, you all are doing it. You all are doing it. Outstanding. The fact that we can even have this grown folks conversation, right, says a lot. All right, next. What are you doing here, Mrs. J? You're at the J, I'm at J84.89. And why are you here? Because this is like the subcategory. And underneath it, it says interstitial pneumonitis, right? So I just thought, we should just see that J84.9, and it says you can code, this is interstitial pneumonitis. But I wanted you to see the supplementary term underneath it. All right, next, I'm going to hone in on the CKD because that's one of the codes that I need to know on site. I know my CKDs, right? And I also know that chronic renal insufficiency is CKD unspecified. How you know that, Mrs. J? Because I see it right up under N18.9, chronic renal insufficiency. So if N18.9, which is CKD unspecified, that means they didn't specify the stage of the CKD, right? Right. And it's also synonymous with chronic renal insufficiency. But if I look at C, C is coding for N18.6. This is stage 6 or end stage renal failure. There's no mention of this patient being in end stage. So we're going to get rid of UC, and that leaves B and D. And then I'm looking at what makes B and D, what distinguishes them. Well, I'm looking at this R09.2. D doesn't have it, but everything else is the same. So what is this R09.2? If you look up R09.2, this is hypoxemia. Absolutely, we have to code for hypoxemia. It's on the discharge summary. And B is our answer. Coders, how are you? Everybody good? Yay, I see those hand claps in the chat. People are saying they got it, they got it. Yes, 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 that's what I'm talking about. And now, question 7. Using the following illustration from the table of drugs and chemicals in ICD-10-CM code book, which code would a coding professional select for the following diagnosis? Initial presentation for excessive drowsiness due to sensitivity to periactin taken as prescribed. A. T45.0x2A, B. T45.0x6A, or C. T45.0x4A, and D. T45.0x5A. Okay, coders, your time is now. And the 7th character A is for initial encounter. All right, coders, your time begins now. Look at that. Somebody answered it that quick, and that's what I want you all to do. 2 people have. Outstanding. That's what I want you to do. After this scenario, I'm going to teach you something, and you'll be able to do it too. Boom, boom. Outstanding. Outstanding. I am just, you know what? I need to put myself on mute. You all, I'm disturbing you, your concentration. Okay, I think you all finished early, so let's get going. I don't think you need me. You all got this. Okay, so I'm going to go ahead and inventory, and all we have is initial presentation for excessive, excessive drowsiness due to sensitivity to periactin taken as prescribed. Keyword prescribed. All right, coders, just so you know, poisonings, all these poisonings, 6 character 1, 2, 3, and 4, these are improper and they are not prescribed. The only one that is prescribed is adverse effect. 6 character is a 5. On site, know that adverse effect is the only one that is prescribed, and it has to be have been properly taken or administered. So there's a presumption that it was properly administered whenever you're coding for the exam, and adverse effect is our answer. So the answer is D. Now, coders, just want to remind you that there is a guideline in your MCG manual. This is the guideline from the MCG manual. It's IC19E5, Chapter 19. An adverse effect is a drug that's been correctly prescribed and properly administered. And then the others, all poisonings, the drug was not prescribed or not taken as prescribed, so it's wrong, right? And underdosing means too little medication. Overdosing is too much medication. And toxic effects is when a person ingests or encounters a harmful substance. Just So, always remember that. Now, coders, one thing I got to ask you. We know it's D. In the real world of coding, how would you sequence this answer? If a patient had excessive drowsiness due to the sensitivity to periactin, how would you code it? If you know, type your answers in the chat. How would you sequence? That's right. Somebody said the symptom goes first. Absolutely. Drowsiness will go first, then your T code for adverse effects. Now, if it's a poisoning, your T code is first. All right. Excellent. The answer is D. Let's continue.
Thanks for tuning in, and until next time, happy coding!